Let's dive into today's NCLEX question. And you guessed it, it's going to be one looking for priority order. A 6-month-old infant has been admitted with a diagnosis of meningococcal meningitis. The primary healthcare provider has written multiple stacked prescriptions. What is the priority order that the nurse should implement these prescriptions? Take a look at your options. Leave us a comment on how you'd prioritize. Let's dive in. When you look at the stem, what's the problem? Meningitis, right? I know that it can either be viral or bacterial. And meningococcal is what? Bacterial. I know that bacterial meningitis is highly contagious. So what is the priority thing you should do? Place the client on droplet precautions. This will protect everyone else and yourself from getting meningitis. What is the second? Start the IV. This is standard treatment. The client will need fluids and possibly medications, and you can't do anything else if you don't have an IV in place. What is the third? Draw the lab cultures. Do you think it would be a good idea if you get your first set of labs when you start the IV? Yes, that way you limit the number of needle sticks. Always make sure that you have your cultures drawn first before starting any medication. You don't want to skew the results of your cultures. What is step 4? I know some of you wanted to give the medication next, but because we just talked about not starting antibiotics until after your cultures. But aren't we looking for infection in the CSF? Yes, we also want to culture the CSF. So we need to prepare the client for a lumbar puncture next. Then, of course, starting the ceftriaxone is last, after the cultures are collected. Is the order what you selected? Great. That means that you are a safe nurse. A safe nurse equals keeps patients alive. Good job.